The central focus of my research is emergence. The concept of emergence is how rules, properties, interactions at the molecular cellular level give rise to tissues, organism level, physiology level, the behaviors and functions and properties. This multi-scale understanding of spatial-temporal dynamics emergence is fundamental to systems understanding of biology, and ultimately it may lead to better understanding of health and diseases. The main challenge is the complexity across different scales. So the interactions across multiple spatial and time scales often come with a very large amount of data, for example, omics data in one scale and very few data in another scale. So this mismatch of availability of data and the quality of the data is a large challenge. And advanced computation allow us to use experimental data, some richer in one scale, lack of it in another scale, but we integrate it to build hypotheses, and then we use computational tools again to test those hypotheses over very large parameter space. So the research in our lab has two general directions. One is mechanistic modeling based on biological data. So example would be cancer invasion. That's the first step of cancer metastasis. Or another example would be wound healing in the retina. We also use another direction is data-driven machine learning-based analysis for big data. Example would be to analyze breast cancer survival or breast cancer therapy resistance or antibiotic resistance, those kind of problems. And without high-performance computing, this would be impossible. So this is an easy one from us because we all know that cancer is one of the biggest killer of diseases. Better understanding on how cancer develops and how cancer invades and how cancer kills is help us design better treatment strategies and understand better efficacy drugs. So we are also studying, for example, a current research project is on modeling combination chemotherapy, radiotherapy, and immunotherapy. So it's a very complex system, again, cancer system, immune system, host response, and we are developing mathematical models in order to explain all the experimental data that we can have. And in doing that, we understand not only the basic constraint, the basic biological possible understandings, but also leading to better designs of strategy. Another ongoing research is related to wound healing in the retina, which is important aspect of age-related macular degeneration, which is a looming epidemic for the aging population. And there's no current effective treatment. So we hope that our research will lead to better treatment options. And antibiotic resistance, I don't need to mention its importance. It's really one of the world's major public health threats. And we are trying to be able to distinguish as early as possible the antibiotic resistant strains of certain bacteria and come up with more effective, or at least differentiate different treatment strategies. So it's easy to see the impact on the broad audience.